Thank you, Mr. Chairman. You know, the tragic situation in Flint has captured the attention of the nation, that is for sure, and the events that unfolded are simply unacceptable. And sadly, there were missteps at all levels of government. What happened to Flint and its residents, especially the kids, being poisoned in their own home, absolutely breaks your heart. And long after the media leaves Flint and the dust settles, families, real Michigan families, will be grappling with this tragedy for decades, most likely lifetimes. That's why today's hearing is going to take a look forward. I've said before, and I'm going to say it again, that I'm not interested in finger pointing. There has been much of that done already. The focus needs to be on the folks who are impacted, especially the kids, and what we can do to ensure that this does not happen again anywhere. We're interested today in examining the underlying causes, various public health implications, and potential solutions moving forward. And while we can't rewind the clock to prevent the colossal failure of public trust, actions taken by both the state of Michigan and the federal government are important steps in the right direction. The administration and state have coordinated to disseminate public health education, provide case management and interventions for kids with elevated blood levels, and have worked to identify vulnerable populations in Flint who may need further targeted outreach. The federal government should work with the state to ensure that proper testing and monitoring is indeed taking place. We know that early education is a critical factor in combating the effects of lead exposure. In February, HHS awarded grants of $250,000 to 2 health centers in Flint. These funds are being used to hire additional personnel, provide more testing, treatment, outreach, and education on the lead exposures. HHS has also announced an expansion of Head Start, an early Head Start in Flint, and a one-time emergency influx of $3.6 million for these programs. Thank you. In March, CMS also approved Michigan's application to establish a 5-year Medicaid demonstration project in response to the public health emergency. Michigan will expand coverage for kids up to age 21 and for pregnant women with incomes up to and including 400% of the federal poverty level who were served by the Flint water system from April of 2014 through a state-specified date. Additionally, Michigan has indicated that it will implement a state program to make available unsubsidized coverage for higher-income populations in Flint. Here in the House, we also took action, and we passed H.R. 4470, the Safe Drinking Water Act Improved Compliance Act, by a vote of 416 to 2. This bipartisan solution, championed by Flint Congressman Dan Kildee and co-sponsored by the entire Michigan delegation, ensures that the public is notified of excessive lead levels in the drinking water and also clarifies and improves the process of federal, state, and city officials communicating promptly with each other, as they should. Communities across the country, mine included, and would note this is this week's, my local paper earlier this week, the Herald Palladium, with the headline, U.S. water systems repeatedly exceed federal standards for lead. All communities are worried about water infrastructure issues. And our bipartisan bill that passed again in the House specifically calls on EPA to help communities develop a strategic plan for dealing with emergencies like this before they happen. Today, we expect to learn more from EPA about its plans with the lead and copper rule under the Safe Drinking Water Act. We're also going to learn from Michigan's Keith Cray and Nick Lyons on what steps the state and community are taking to get Flint water back up to national standards. In the second panel, we're going to hear from an Association of Water Utilities and Association of State Drinking Water Regulators what lessons that they have learned and what they are doing to apply those lessons. We're also going to hear from Dr. Mona Hanna-Attisha, Program Director, Pediatric Residency at the Hurley Children's Hospital. Dr. Mona, as she is called, provides an important perspective on children's health, and I'm pleased that she is with us so that we can continue to work together. It's my hope that this hearing is going to serve as a valuable opportunity to hear more about this important work, ideas for further steps that can be taken by the federal government and the state of Michigan to help the people of Flint, and how Congress can ensure with confidence that this does not happen again. We cannot and we will not forget those in Flint who have been impacted by this tragedy. No amount of regrets or words can actually fix what's broken. We need concrete action.